Good morning, everybody. I want to welcome all of the leaders, donors, and activists of Cadena Yesod in Latin America, in Spain, and in Portugal. My name is Daniel Pichotto. I'm president for the Colombian campaign of Cadena Yesod. And with this, I would like to welcome and say hello to Mr. Sam Grunberg. He is world chairman of Cadena Yesod, the United Israel Appeal. Sam, good morning. Good afternoon, I'm sorry.
Thank you. Thank you so much, Daniel. Bienvenidos, shalom, hola to all of you. It's great to see you all, at least on Zoom. We're really very fortunate to have this special webinar and such a distinguished speaker, Professor Ronni Gamzu, who I'll formally introduce in just a moment, and especially to speak at really a critical time on this very important topic. Just before I introduce Professor Gamzu, I want to take this opportunity to thank all of you, the leadership in Latin America of Cadena Yesod, in so many different campaigns, the presidents, the women's division, young leadership, all of the activists, and really all of you for your ongoing support and leadership, specifically and recently also for your heartwarming and impressive response for the Solidarity campaign that we had in May during Operation Guardian of the Walls. Really, I want to say Toda Rabba, not just for that, but for all that you do in the Latin American campaigns of Cadena Yesod for years and years with such dedication. Toda Rabba. I'm really very happy and proud to introduce Professor Ronni Gamzu. I had the opportunity to sit down with just a couple of weeks ago, and I'm also proud that we at Cadena Yesod have really good and renewed cooperation between Cadena Yesod and Ichilov Hospital. And I'm really excited to formally introduce and to hear from Professor Gamzu. So Professor Ronni Gamzu is currently the CEO, the Mankal of the Tel Aviv Ichilov Medical Center since 2015, with a short break in the middle, which I'll mention in a moment. Professor Gamzu began his medical career in the hospital 25 years ago when he was a third-year medical student. He's a professor for gynecology as well as associate professor in public health and business administration, all graduated from Tel Aviv University. Since 2002, he is part of the Tel Aviv Ichilov Medical Center management, first as deputy director for health economics, and later in 2008 became the director general of the hospital. In 2010, Professor Gamzu was appointed as the Director General of Israel's Ministry of Health, where he served for 4 years. In 2014, he was appointed to be a Senior Health Policy Analyst in the OECD in Paris. And I'm sure that we are only just mentioning some of his really remarkable achievements. And of course, last year, Professor Gamzu was appointed by former Prime Minister Benjamin Netanyahu as the National Coronavirus Project Coordinator and as Director of the Special Operations Control Center. And I could say, especially at an extremely critical time during the pandemic here in Israel. And he was the one who launched the national project for protecting the older adults and the older citizens from coronavirus, as well as many other great achievements. So, Professor Gamzu, it's really my pleasure to introduce you, and we look forward to hearing from you. Bevakasha.
So just a small modification. I would just like to welcome and thank you so much. Just to make sure that you understand, this is the Tel Aviv Sourasky Medical Center. Sourasky family is a very important support and contributor to this medical center, and indeed this is what we are trying to do. I will give my lecture, and thank you so much for this nice introduction. I will give my lecture focusing on the way we as a hospital, we as a system in Israel took and did the operation of combating and and meeting the challenge of Corona all during the last 18 months. What all of us around the globe has experienced, we as well. So let me start with my presentation. I will do a sharing of the presentation, and we are still in the process. we are still trying to make sure that we are handling this crisis in the best way ever. It all started around February 2020, and all the world has experienced that. The healthcare system in Israel is a public one, and most of the system composed of 4 sick funds, as well as hospitals, public hospitals. Okay, a small technical problem. We are just managing it. So I hope that everybody sees that. So really the challenge was to give assurance and resilience to the Israeli people all around Israel that we are taking care of them. We are a public set of healthcare system, but we will run it like we are used to do in the most professional way. And this is what we were trying to do all along the crisis, understanding that this is a crisis that needs to be in front of the people, giving and building the trust of the entire state of Israel. This was our duty. We understood that we are, the Israeli IDF in this kind of crisis. And we must lead the way for the entire nation, for the entire Israel, in a way that we have done all around the crisis. The first sign was the outbreak and the spread all along China. It was, we were all aware around January about that, but still we were not alarmed all around the world, and we started to understand the magnitude around approaching the end of January. I remember that we had a discussion 25 in January, 27 in January, whether to close flights from China, and Israel was one of the first country in the 30 in January to close flight. In that sense, we were trying to delay the approach and the introduction of the virus into Israel. And of course, this gives us time for preparation. We have seen the global spread all around China, Thailand, Japan, and then it was introduced into Europe and the States. At that time, we were preparing hospitals, healthcare system all around Israel. The first action in Israel was preparations. We know we are used to such events, to such challenges. We have, a huge system of preparedness. And around February, what we were doing is preparing the hospitals, preparing the sick funds, preparing our healthcare workers, how to treat, what is the new virus. And it was appearing in the middle of February, first time in Israel, and around the end of February, we have seen, the scenes, not only from China, but also from north of Italy. We understood that any healthcare system around the globe is going to face with a challenge. This is the time that we were embarking on meeting the challenge and preparing ourselves to handle it. In this hospital, we understood that we have a virus that is airborne, that it can move through air in a droplet way. So we were preparing the department in the infrastructure, in the right infrastructure, and looking for the right, indication, how to treat, how to diagnose, preparing all that in our labs. And indeed, in the beginning of March, the 10th of March, we had the beginning of the first wave in Israel. The numbers were doubling every 2 to 3 days. 50 patients around Purim grew up to hundreds of patients. This hospital received around the 10th of March a lot of patients. We have to open one department, the second department. We had to handle these cases in the emergency room. And the first thing that I was focused in is to give the resilience, the confidence, the trust of my healthcare workers, physicians, nurses, anyone that is, have a role, a medical role in the hospital, had to find the strength, because we knew that we can and we will treat the patient the best in the world. And this is what we are pushing in, to give them the best protective measure, the best protective equipment, the best protective environment in order to treat the patient. And of course, this was not enough. The first wave in Israel was, of course, we needed to do lockdowns like all the world. The first lockdown beginning the 12th of March. We were closing schools. I was in that discussion, in that unprecedented decision to close the entire education system in Israel. Gradually, 2 to 3 days afterwards, we were closing the commerce system, and then we did a lockdown, allowed Israelis to go on into distance of only 100 meters from their home. And by that time, we have reached the peak of almost 1,000 cases. We understood that we have more cases than that, but at the beginning of April, we were seeing a decline. We understood that we were over the peak, and of course, we were handling all the situation in that way. This hospital, the Tel Aviv Medical Center, was doing what was needed, and everything was under control. And at the Passover, we had the most extreme lockdown all around Israel. People were almost not leaving their home, but the number of cases were dropping down, and the hospital under my management was doing fine. Everything was under control. This is the time that I was called into the national system in order to give my assistance and run what we had. That was a lot of cases in the nursery rooms around Israel, and this is what we were doing. We will call that Mother and Father Shield. I was head of this project. We had to control 1,000 nursery homes around Israel, and what we were doing is giving them national support, not letting them dealing with this challenge alone. We put a lot of resources, a lot of human power, a lot of healthcare workers, people with protective measures, with all the equipment necessary in order to protect the elderly in the nursery homes. 1,000 nursery homes around Israel. In 2 to 3 weeks, we calmed down the epidemic there, and the number of cases also in the nursery homes begin to drop. We have done a screening of the nursery homes each week. Everyone, healthcare worker, people, tenants of the nursery homes, people that are hospitalized there, people that are staying there, were going through corona testing every week. And this is the way that we have stopped the epidemic or the endemic situation in the nursery home, and saved a lot of lives. This was the first wave. This was how Israel was defeating the virus in the first wave. But then we did a mistake. We are Israelis. We are going out of war to a peacetime within a day, and we did that with corona as well, with a lot of mistakes. So we went very fast, reopening the entire state of Israel. commerce, education system, you name it, everything, even cultural events, very fast, within a month, from the 19th of April to the end of May, everything in Israel was, open. And you know what? Corona really took the opportunity, and we had the second wave around the world. All because of the hasty lifting, of the hasty reopening. I had a column in our newspapers, why is the rush? Why we are doing that too fast? Yes, reopen. Yes, continue, to live economy, bring back economy, but do that gradually with, the right set of rules. Although we are Israelis, Corona wants order. Corona wants things to be ahead in a very order way, and still to make sure that we are not letting the virus take the opportunity. But this is what happened in Israel. So we had a second wave around already the end of May, beginning of June. Israel has had the second wave around the globe. Other countries around Europe, even the States, Australia, you name it, were countries that still were gradually entering out, reopening after the first wave. Israel was already in the second wave. Hundreds of cases, thousands of cases, and what was happening, it was gradually increasing, and hospitals gradually were beginning to be packed. And this was the time that people in Israel lose their confidence and trust in the government, because they were saying, you told us to go and celebrate, you told us that this is over, you told us to reopen, to get back to our lives, and now you are doing lockdowns and restrictions again. So this was a time of, almost a depression, blues in the citizens of Israel, all the people, all the population, all the communities, you name it, people were against the government, against running the system, mistakes that were done in the Ministry of Health, mistakes that were done around decisions that were making by the policymakers. And this was the time that everybody understood that we need to take an action and to have a new set of governing the project, and I was selected to be the project manager. It was almost at the end of July that I received the nomination and the position from the Prime Minister of Israel, Netanyahu, and the Minister of Health, Edelstein. And you know what? I didn't respond with a lot of thinking, just went ahead. The position or the task was to bring about again back the public of Israel, the population, every single man. You have to understand, Corona is a challenge of the individual, of the family, is a challenge of the community. They are sacrificing their living, their life, their freedom even. So they want to give you the trust. They want to build the confidence with the right person and to be sure that there's no politics involved. They want to see a professional, somebody with reputation. And humbly, I was Director General of the Ministry of Health for 4 years. I'm directing a very large hospital, if not the largest in Israel. So people tend to give me a lot of trust. And after the mother and father shield at the first wave, that the people have understood that we have stopped the number of cases in the nursing homes, they understood that a sort of person like me can be in front and do the job. And this is what I was doing. So the first challenge and the first key factor was meeting the trust, building the trust, going back to the people, confronting them, being close to them, giving them the right scenario in a transparent way, letting them understood, building a contract. In my saying, it was a new contract. The key factor was saying to them, I will be honest, anything will be logical. We will issue anything with the most transparent way. We will try to, to avoid a very stiff and extreme restriction. We will try to avoid lockdowns. But I need from you a favor. Go ahead with me. Follow the regulation. Follow the rules. Social distancing, masks, and please be aware. Try to reduce the number of people catching corona. This was a contract between me, myself, and the public, and the people of Israel. I was confronting them in any media possible and daily appearing, saying my voice, saying the situation, explaining what the next step is, and trying to avoid lockdowns. I was entering my position in the middle of July until the middle of September. For 2 months, Israel was widely open. All activities were there, including summer school, including education system, including commerce, including cultural events. Anything was in place, and we were not in lockdown. This was the contract. And I was saying, the minute the hospital and the healthcare system will be overwhelmed and raising the red flag, we will see that, they will say that to us, and we will go into lockdown. And this is what happened all around the first 2 months. The second key factor with the new contract was doing a lot of tests and a lot of inquiries in order to cut the active chains, to do cut off of infection active chains. And for that, we did and widespreaded the corona test all around the country, any place possible. And in order for that to succeed, we aimed at reaching the highest number of corona tests per population in the world. And this is what we achieved around October. In October, Israel had the highest number of corona tests per population. This is, and we have to understand corona. Corona still now, even now, corona is mostly an asymptomatic disease, mainly for the young, meaning that the engine of the spread is that it's spreading through the asymptomatic cases, through the young, even through the children. It's reaching cases with the elderly, with people with chronic disease, where they have moderate to severe disease, but largely mild disease or asymptomatic. This is the way that spread. In order to stop it, you have to identify. In order to identify, you have to do a lot of corona tests. This is what we were doing. Another key point was to adjust the restriction to the number of corona cases. You know, restriction could not and should not be a national average. And corona cases per population should not be an average. You have to link it. If you have a city, a community with high number of cases per population, then they need to have more restriction, even lockdowns. But you cannot do and should not do that for the entire country. This was a traffic light plan. That part of it was approved by the government and part of it was approved but not all the time accepted by the government. There were a lot of debates, not only in Israel, all around the world, about traffic light logic. But epidemic is an epidemic. Sometimes we have that in one city, you do not have that in another city. And it changes. It is a dynamic way of changing the route and the density of cases. And in order to reach confidence, to build the confidence, to build the trust of your public, you must be logical. In an area, in a geographic area, in a city that you have 0 cases, there is no logical and no logic to do, lockdowns. This is what we are trying to do, succeeding, going ahead with the traffic light. Even up till now, we are coloring or remarking cities as red, orange, yellow, and green according to the density of cases. And this is what we are doing even now on the so-called 4th wave that we are dealing now in Israel. Yes, and the number of cities or population with red color, orange color, yellow, and green was all the time transparent, appearing for the public. Anyone could see by application, by the smartphones, what's happening in the specific city. All around this time, we were using the home front command in the IDF. We understood that in order to succeed in Corona, you need the best operating organization that you have in your country. In Israel, it's the IDF. So we brought the IDF into the civilian life in order to succeed. Not only in running the operation, but also in doing the testing of Corona, in doing the inquiries of people exposed for Corona, and the quarantine, giving the operation of entire Israel for the army in cities, in municipalities, doing that in a civilian way, doing that in a way that the people, the public will accept. And we have a diverse population in Israel, ultra-Orthodox, Arabs, Tel Avivians, very, very diverse. But the army has the best operation. Running 300 municipalities that needs, different resources, different type of infrastructure, different type of operation, linking that to the cultural, characterization of each city. It takes a good operating body, and this is what we were using with the Israeli Home Front Command. Because Israel is one Israel, but we have diverse communities, diverse population, ultra-Orthodox, Orthodox, we have regular seculars, Tel Avivians, peripheral as well, Arabs, Muslim Arabs, you name it. Israel is very diverse. And Corona, when you are meeting such a diversity of, cultures, you have more and more complexities, different holidays, different kind of habits, different kind of the most sacred things to the population, different cultural habits, events, you name it. Everything is very complex. And sometimes you will find one community against the other one, because the number of these communities is rising up, and Israel had a huge challenge in that sense. If you are taking few of the part of the communities have a political leverages, then you are getting, a very complexity kind of running the job. I'm not complaining, but just to tell you what was the effort around that. And you had to approach it. I built 3 desks. In the way that we operated around Israel, there was a desk for the ultra-Orthodox, there was a desk for the general population, and there was a desk for the Arab population. Each desk adjusted the steps, the operation, the way to educate and speak with the public in different ways. This is the only way to go, not only in Israel, but any other country with such a diversity of population. We had trouble what to do with schools. What is the age factor with Corona? We're still debating on that. Whether children are really the engine of the spread of the epidemic. They are asymptomatic. You do not know, can they transmit between one to another, or whether it's only between adults. And we understood that there is an age factor, and the children, Israel is a very young country. A lot of children, a lot of young ages around the country, and we understood that they are really an engine for the spread of the disease. And we understood that any age can transmit corona to another age. It is more common between the same ages, but still we understood that adults are also a very important transmission factor between children and adults. So we had to be aware, and we are trying to do our best in the school system. Israel's school system is very crowded, and it was and still is a debatable issue how to run Corona with schools, with kindergartens in a state like Israel, where you have an average, a young average age. Then of course it's very, very challenging. Still, Israel went into second lockdown. The second lockdown, first in the world, was appearing during the holidays in Israel, the middle of September. The number of cases went up after opening schools in the 1st of September. The number of cases within 10 days, the number of cases tripled. So we understood that we have to go under second lockdown. It was during the holidays, the Tishrei holidays in Israel for the Jewish. It's a tough month, I would say, but we understood that anyhow, anyway, the holidays, the Tishrei holidays, Rosh Hashanah, Yom Kippurim, Sukkot, are such that will need special restriction. We understood that anyhow, without a second wave or with a second wave. So I must say that we took that in a very sensitive way to the public of Israel. It's not holidays only for the religious people, only for the ultra-Orthodox people. It's the holidays for any Israelis, for any Jew. And we understood that, and we approach them in a way that we say, this is within your hands. We are in a tough situation. We are going under lockdown. We will reopen after 3 weeks if you will succeed. You will succeed. If you will do what is necessary to be doing in such holidays. When you are, you are going to the synagogues, you celebrate the holidays, do that under the regulation, under the restriction, under the lockdown. Understand what you are facing. It's a matter of life. Do that. And the Israeli people understood that this is their test, that this is the time, that this is their time to take responsibility. And they did. Within 3 weeks, the number of cases in Israel went down from 9,000 a day to 600 a day. More than tenfold down. And this is what Israelis, when they are confronting a challenge, they are succeeding. And the respect and all the admiration is for these people that stood in the second lockdown and succeeded in giving Israel another time of grace before the vaccination. We were reopening in October. We reopened gradually, in a gradual way, and we were trying to do that in not like we were, reopening after the first wave. Here we were more cautious, we were more careful, doing that in a very gradual way, step by step, and we succeeded because it took us around 2 months or more than that to be in a steady state, but then we had another surprise, and we'll go over that because the next surprise were the mutations. Went into Israel around the beginning of December, coming from all around the world, not only from the UK, and created in the second half of December the third wave in Israel. Of course, the British mutation within a month, the British mutation, the British variant, now we called it the Alpha variant, was most common, almost reaching 80% within a month or so. And of course, it has a higher infection rate. The challenge is higher with that. So we had our third wave. But luckily, I would say that we were not the only one. It's not luckily, but we were not the only one. The European surge came at the same time. It was their second wave, our third one. But there was a surge around November, December, again with the variants all around Europe. Israel was in a better situation because we were after our second lockdown and opening gradually. Vaccination is ahead still. This is November. There are the first news about the vaccination, but before that, we have the third wave in Israel around December because of the British or the Alpha variant. And indeed, vaccine changed the course. Israel from April to 2020, from April, we are focusing on vaccination. We are a country that has a culture of vaccinating the entire population. We know from the youngest age, and we have around 95 compliance rate in most of the vaccines that are used in the vaccination plan of the entire state of Israel. From April 2020, we are focused on that. We were looking for the best companies, for the companies that are developing and doing the R&D for corona vaccines. We understood that we have few technologies. The new technologies of messenger RNA are really such technologies that we are aware about, we know about them, we trust, we know that they are acceptable technologies. We were following and doing our best to make contact and to allow ourselves to have the opportunity or the option to have the vaccine once they will be approved by the regulatory bodies. I was in a few meetings in August, since September, that were led about by the Prime Minister of Israel. He was very involved, but of course the professional leaders from the Ministry of Health and all of us were involved in looking ahead and saying to ourselves, the only solution for such a pandemic, any epidemic, is vaccine. You cannot, deal with such a pandemic, with social distancing, with lockdowns all through the year. So we're looking ahead, and if you do remember, in the middle of November, the results from the study group for Pfizer and Moderna were the first to be released. We were amazed by the number or the rate of successful protection, and we did our best to achieve, the vaccine. Vaccine in Israel were coming from Pfizer and Moderna for Pfizer by the beginning of December, and allowed Israel to open the vaccination plan in the 20th of December, and to spread the vaccine all around the country. The key factor for the good vaccine or the successful vaccine plan for corona, first, is building the trust and the confidence of your people, not logistic, not sick fund, not getting the vaccine, building the trust, building the confidence, leveling with your people, understanding people that do not want to be vaccinated first, giving them the time, be patient, give them in a humble way your explanation, respect them, try to do that day by day by your opinion leaders, appear in national TV, appear in any media, social media, anything, appear, give your explanation, build the confidence. This is what we were doing. Along with that, best logistic, spread that around the country. And another issue, enthusiastic healthcare workers that running around the clock, feeling that this is the time, the victory is within their heads. This is what we were doing in Israel. We were reaching to reach, 100,000 a day, and reaching to vaccinate around 3 to 4 million within 2 months. And this is what we were pushing ahead to do. Hospitals are doing vaccination, sick funds, EMS services, anything. My hospital give vaccination not only to the personnel, but also to the community of Tel Aviv, to the nursing homes around Tel Aviv, to diplomats around Tel Aviv, to the people that are illegal immigrants in Tel Aviv area, anyone, anybody. All the security and all the security, the Mossad, the high security forces in Israel, all of them were approaching this hospital in order to get the vaccine. This is what we were doing. Of course, Corona had still an economic impact, but our vision is that stepping out of Corona will boom economy again. Everything can be back to normal. The new normal. It's not the old normal, it's a new normal, but growth and economy, social items, anything that can go back to normal will go. But again, my emphasis is that you have to restructure a new normal in anything, in real estate, in commerce, in retail, in hospitals, in healthcare. Anything is going through a new normal, municipalities, cities, anything. This is what we are looking ahead to be doing. The future of the virus. First, the virus is doing its evolution. The evolution of a virus is changing and desire to reach its most stable, variant that mainly is looking to survive. And of course, in order to survive, we must attack human cells in the best way, connect to the receptors of the human cell in the best way. This is what the virus, this is the evolution that we are seeing now with another variant and another variant and another variant. It's changing its molecules by mutation, natural selection theory, in a way that it will have the best molecular structure that will give it as evolution advantages. Whether or not it's going to escape the vaccine, still we need to see that ahead. All the variants did not escape the vaccine. There is a possibility. I believe that this is a far possibility, but it could happen. I cannot exclude it. We are looking ahead at turning Corona from a pandemic an epidemic to an endemic and sporadic kind of disease. We are not looking ahead at eliminating that into zero. This is not possible. This is not the way to go. We have to live with it in a way, make it endemic and sporadic. And our main aim is that it will not endanger or threat no more the healthcare system in a way that it overwhelms hospitals and the resources of any healthcare system around the world. This is the daily or the annually challenge that we have with influenza. And the main issue is turning corona into some kind of a minor influenza challenge. And this is what we are trying to do. And I believe that we will have more vaccine. Whether we need another booster, there's still time to see. It's not, we cannot know that for sure. But of course, when the time passes, we will need to see that ahead. The other message that I have, Corona was also a challenge for the Israeli healthcare system. It's a healthcare system that is based on public healthcare services, not private. This is a public hospital. We are giving free access to any Israeli, to anyone, but we are pushing for the best technologies, for the best healthcare workers, physicians and nurses, or anyone that is giving healthcare services and medical services here. Building the trust that we can win any kind of threat, that we can deal with such challenges. This was my goal here. Taking these, threats, taking this kind of crises and leveraging it into building the resilience of the Israeli people, of our population, trust the services, trust the public services in Israel, trust the services that we are giving in hospitals, in sick funds, in the healthcare system. This was my goal all around these 18 months and from now on, because I believe really that this we have one of the best healthcare systems in the world. We need a lot of support, we need a lot of friends, but we are trying to do the best for the entire state of Israel. Thank you so much for giving me the possibility and the opportunity to speak to you. And I'm open for any questions.
Dr. Gamzu, thank you very much. It's been very interesting. We have 3 questions right now. Please, Mr. Silvokis is asking us, if Israel has a significant level of collective immunization, do you believe the Delta variant can be a threat to break this immunization chain?
Okay, Israel has a dynamic of herd immunity. The dynamic of herd immunity, it's manifested now by the fact that although millions of Israelis, children mostly, are not vaccinated, you do not see here a huge epidemic. And mainly, we have to focus on the severe cases, on the moderate cases that are hospitalized. And the number of that is extremely low. So variant or no variant, we have a dynamic of herd immunization, of our herd immunity. We have to stay in, to be very, very up to our toes. We have to look for, the variants, but I'm very optimistic that we will stand against it because of the high rate of immunization in Israel.
Thank you, Dr. Gamzu. And is another question regarding the production of vaccines in Israel, effective vaccines in Israel. How's that coming along?
We are still trying, but to be honest, it's a tough one when you are facing these very experienced pharmaceutical companies that joined hands with startup, very clever companies. So we are still trying because we know, the corona will be here for years, and I must say that vaccine will be needed, I guess, for years from now on.
Okay, thank you, Dr. Gamzu. And I'm being asked, or we're getting asked, if you have any updates regarding the XOCD24 drug trials. I have no idea what that is.
The drug that in Israel we were starting to develop at the first phase, and now we are at the phase 2, it gives us very good indications that it's going to be very effective in reducing the severity of the disease. It's acting upon the notion that what is making you severely ill in corona, it's not only the virus, it's the immune response, the cytokine storm. And this medication reduces the cytokine storm in a way that the symptoms can be reduced. But still we are in phase 2, we have still phase 3 to go. Developing a drug takes time.
Okay, and there's another question I believe is interesting. Regarding antibodies, is it a good indicator to know that the vaccine was effective or not when taken?
It's a good indicator, but not one by one. It's not an absolute indicator, but it's a good one. There is a good correlation between your immune response and the number of antibodies. But again, it's not an absolute indicator.
And also, Dr. Gamzu, is there an idea when Israel is going to be open to visitors?
If you will ask me, I will open Israel right now. But there is some conservative approach in the way that some of the decision maker takes the airport as a gateway for variants into Israel. I hope that they will reach the understanding that variants are here and variants will be traveling first class, business class, anyhow. And the only thing to do is to do testing before boarding, after landing, and to do quarantine when it's needed.
Thank you, Dr. Gamzu. Do you believe there's a parallel between AIDS and corona? We had the virus pandemic many years ago.
No correlation. No correlation, none whatsoever.
I don't see any more questions. Anybody has any more questions? ¿Más preguntas? I see here, do you think a lockdown would be a solution for a country like Brazil?
You are doing in my way, in the way that I see that. A lockdown is mandated only when the hospital system is overwhelmed, when you have a number of cases that packed your hospitals. This is the only, in my way, in my view, the only indication for lockdown. Brazil answer is more and more vaccines, more and more vaccination. I know that it's tough, but this is my recommendation.
So I'm getting questions on the chat. I would ask anybody and everybody, so please could you ask on the question and answer thing. Somebody's asking, why is the vaccination campaign not working for the younger people? And why do you believe young people are not getting vaccinated?
The narrative for the young is different from the narrative of the old. The narrative to getting the vaccine for the old is protecting them from a moderate or severe disease that will endanger their life. The young, you cannot fool them. You cannot fool the young or the children because they understand that corona is not going to make them severely ill. You have to understand and give them, in a very transparent and honest way, you are getting the vaccine in order to protect the entire population, the entire community, not only you yourself.
Okay. Mr. Bijo is asking from Chile, why would the Chilean people still be struggling with a 72% vaccination rate? The virus seems to be very resilient to the vaccination in Chile.
First, I have to say that it depends on the type of vaccine. If it's Pfizer, then if it's Pfizer and you have 72 vaccination rate for 2 doses, then it's raising a tough question. I cannot explain that. But I guess the 72, I'm not sure that it's Pfizer. I'm not sure that it's all of the 72 are 2 doses.
Okay, I believe you answered the next question, because I believe most of the people in Chile have been vaccinated with a Sinovac, with a Chinese vaccine, and it's not that effective, maybe.
Different effectiveness.
I'm getting asked about the drug that is to be applied through the nose. Is that effective, and when is that to be in the market?
What's the name of the drug?
The drug that is applied through the nose.
Okay. This is our drug. Yeah, but again, I was answering that. We are in the phase 2. We have still to go for the phase 3, and it will take time. I'm sorry, but the regulatory system is not bypassing.
Okay. How many people in Israel are not receiving the vaccine, or are denying the vaccine? They don't want to receive the vaccine. Is that still a high rate?
No. We already gave the vaccine for almost 6 million. Our target population is around 7. So this is less than 1 million.
Okay. There's another question, which I believe is interesting. If people are vaccinated with Pfizer or Moderna or the accepted vaccines, will that make travel easier to Israel?
Logically, yes. Practically, still, there is some kind of conservative approach, as I told you before. But logically, yes. Still, we do not see tourists that are coming from a touristic reason because of the conservative approach for the decision makers, of the policy makers.
Okay. I'm getting asked if a third dose of the vaccine is going to be necessary in October, as Mr. Hezi Levy said today.
Necessary is a very big word for something that we do not have evidence. So it's a possibility, not a necessary.
Does Israel recognize other vaccines like Janssen vaccine. I believe the Chinese vaccine has been proven to be mediumly effective. Is that going to be recognized by Israel also?
Israel is not decided something that is recognized, something that is not. The vaccines that were acceptable by regulatory bodies in countries that we have indication that it was tested, then we accept it. We do not really accept by our decision, but by the decision of any kind, like any other medicine. It was approved by a regulatory acceptable body, like the FDA, like the EMA in Europe, then we are accepting it.
Do you believe, Dr. Gamzu, that the Palestinian refusal of vaccines is going to affect the Israeli security or the Israeli health security program?
Could be. We look at public health in a matter of an area, a geographic place, not in a matter of states. And the fact that the Palestinian Authority or the Palestinians that are living in the Palestinian authorities are not vaccinated in a high rate, it's a disadvantage, and we must reach and lead to a way, to a solution that will let Palestinians in the territories be vaccinated as Israelis here.
Okay, is it possible, or do you believe it's possible to getting some feedback here? Get a Pfizer vaccine if you've had the two vaccines of the Sinovac vaccine? Would that be effective? Is that dangerous?
There is no indication that it is dangerous. We are not, pretty encouraging mixing vaccines, but we do not have an indication that it is dangerous.
Also, I'm getting asked is it possible to donate the vaccines that are expiring in July to communities in Latin America?
Well, this depends on the contract. I do not know the details of the contract that we have with Pfizer, whether we can donate or transfer or anything to a third country or to a third body. I'm not into the details of the contract.
Okay, and I believe a final question. Time is pressing, I suppose. Dr. Gamzu, thank you very, very much. A final question. Is there going to be tourist vaccination programs in Israel? Vaccines open for people who want to come to Israel?
Well, again, it depends on the contract that you have with the pharma company, whether you are getting the vaccine in such an amount that you can, and offering that, for tourists for free, paying them for that. So I guess there is some kind of details within the contract. I don't want to see, all kinds of strange vaccine retail initiatives around the world.
Okay, well, Dr. Gamzu, thank you very, very much. It has been very interesting. It's been a fantastic morning for us who live in Latin America. I suppose a great afternoon for everybody else. And hope to be able to meet you very, very soon. It's very enriching. And thank you to everybody in all over the world who has accompanied us in this conference. Thank you very, very much to everybody. And Dr. Gamzu, big pleasure, big honor. Thank you very much.
Thank you so much. Have a good day. Love you all.
Thank you very much. Señores, caballeros, muchas gracias. Buenos días, buenas noches. Bye bye.